Welcome back. Researchers are getting a detailed new look at the human heart thanks to a new form of CT imaging. It captures the anatomical structure of the heart down to 20 micrometers. That's half the width of a human hair. European researchers call it the Google Earth of the heart. Study co-author Professor Andrew Cook hopes it could improve treatment and surgical outcomes. Researchers have imaged 2 hearts so far, but plan to scan more to account for differences in age, gender, ethnicity, and disease. July is Sarcoma Awareness Month. It's often referred to as the forgotten cancer due to its rarity, accounting for only about 1% of all cancers. Orthopedic oncologist Dr. Daniel Lerman says patients often ignore a growth that causes pain in the body, which can occur at night or while resting. Sarcomas are more common in children. Dr. Lerman says they make up between 10 and 20% of all cancer diagnoses. The number of COVID cases is spiking across the country. According to the CDC, nearly 40 states are reporting high COVID activity levels, and emergency room visits are at their highest for the coronavirus since February. An ongoing issue stemming from the COVID lockdowns of 2020, many students are still falling behind academically. The NWEA, a testing company working in more than 9,000 school systems, found that for this past school year, average math and English test scores in nearly all grades were down from what they were pre-pandemic. Lead author Karen Lewis is the Director of Research and Policy Partnerships at NEWA. She says data from the 2021 to 2022 school year looked promising, but the past 2 years have shown there's still a lot of work to be done. The NWEA recommends using local data to set guidelines, expanding class time for certain students, and talking to parents about the importance of recovery. Summer is prime time for enjoying the outdoors, but that also means sunburn. This time of year, it's easy to get too much sun, so what is the best way to treat a sunburn? Susan Elizabeth Littlefield has the answer to that burning question.
Amidst all the joy at the Richfield pool, there's also pain.
It hurts.
It hurts to the touch.
It hurts. It's uncomfortable, like a lot, and then it starts to itch.
Painful, a rash.
And he knows overexposure. The pool is his office. And even though everyone here knows the rules, do you guys wear sunscreen usually?
Yeah.
Accidents happen.
Oh, look at that.
Yeah.
Oh, yeah, it's all over here, too.
It's on both my shoulders.
Oh, my God. I thought you put on sunscreen when you were there.
I did. But we were there for like 5 hours.
I really think that most people get sunscreen on once, but they forget to reapply every 1 to 2 hours.
Dr. Farhat is a busy
I see 30 patients a day.
Alina dermatologist, and she's seen many a sunburn.
What's actually happening to our skin?
Anytime that your skin is turning red, that means that there's actual DNA damage that's occurring.
She says sunburns can range from redness to blisters that peel and even open sores.
So basically, you want to start treating right away.
I had to apply aloe and kind of that type of stuff to kind of ease the symptoms.
So aloe is definitely helpful for that soothing component.
I heard when I was little that you could put vinegar in a bath.
So I don't typically recommend that. There is a soothing component to oatmeal baths, and so that would be what I would recommend.
Oh, oatmeal.
Who knew?
Yeah.
Also surprising.
Something like ibuprofen, Aleve, things like that are going to actually help sunburn, so help prevent some of that pain and redness, not just for the pain, but actually treating that underlying inflammation that's occurring. And so as soon as you realize you're starting to get sunburn, taking that right away is going to help prevent it from getting worse.
And allow for more fun. Susan Elizabeth Littlefield, CBS News.
After the break, how one company is helping people with special needs while serving up specialty snacks, and how Barbie is becoming more diverse to reflect medical differences.